What prevention do you recommend for my dog?
Typically, the recommended prevention that we like here at this clinic is we stick to Simparica Trio a lot of the time, just because this is easy. It's a once a month tablet, and it does treat against heartworms, fleas, and ticks. And it has a little bit of some dewormer in it that you're giving once a month. However, it is also dependent on the patient, their risks, and what clients like. And some pets, it depends on if they're going to eat it or not. We have several different ones here as well that we carry at the clinic. One of them is HeartGuard, which only does heartworms. And it also helps prevent against a couple of the intestinal parasites. This is a big chew that they take once a month. Its sister product, if you wanted to treat for fleas and ticks, is NexGuard, which we also carry. The big difference is that this one doesn't get the fleas and ticks, and you'd have to have the sister if you were worried about fleas and ticks or have any possibility of getting them. Another product we carry too is Sentinel Spectrum. This one does heartworms, does some of the intestinal parasites, and it has like a flea control, but what it does is basically it's like a birth control for the fleas, so it doesn't kill the adults, it just keeps them from producing more babies. So you get rid of the fleas as they die off. That would be a caveat where I can put in here that fleas, they can live up to about 100 days. So you could have an adult flea in your environment that long. So doing this for at least 3 months, if not 4, to make sure that you're completely gone with all your fleas. This was NexGuard with HeartGuard. We do carry ProHeart, so there is an injectable heartworm prevention that is given once a year and you can do it at your annual visits. We do recommend testing for heartworms every time at your annual visit to make sure the medication's working, or that if you've missed a dose, we don't all of a sudden have heartworms that we need to worry about in treating. The ProHeart injection is an every 12-month injection. Like I said, it cannot be given until they're a year of age, but it is nice and convenient. It does not get any of the intestinal parasites, fleas, or ticks. So if you have any concerns about any of those, we need additional prevention. There are a lot of other heartworm preventions, fleas and tick prevention on the market too. So these are just the ones we carry in the hospital. If you have one that you've been on in the past or that you really like or that you've done your research on and you're interested in getting a prescription for or whatnot, we can definitely help accommodate that so that your pet is still well taken care of and on its prevention monthly.